It's about this flu season reaching epidemic levels and particularly how it's been hitting children. The latest figures show widespread flu in almost every state. 45 children have now died of the flu during just this flu season, 19 of them in the last week's time. All across the country, a much more lethal pace than in years past, and doctors say it has to do with this particularly aggressive flu strain this year and a vaccine that didn't live up to expectations. Our report tonight from our chief medical editor, Dr. Nancy Snyderman.
16-month-old Angel Tlamani was rushed to the hospital yesterday by his mom, Jamie.
He would get up and start crying, and the breathing. Hearing your kid like that is just like, you gotta take him to the hospital.
On the front lines of the epidemic, Dr. Christina Gagliardo at Maimonides Hospital in New York, treating Angel and other children. The number of pediatric deaths is 4 times higher than last year at this time.
About 70% of the strains that we're seeing circulate this season have drifted, meaning they've changed a little bit and sort of outsmarted our vaccine this season.
That's frustrating.
Yes, very.
Even though Angel was vaccinated in October, he still got the flu.
Do you expect him not getting sick or not being in the hospital for those reasons?
This year's strain causing otherwise healthy people to get really sick, adults too. Across the country, some of those who've died, a 40-year-old mother of 2 in New York, a 26-year-old newlywed and healthcare worker, a 23-year-old young man from Massachusetts, and a 12-year-old in Wisconsin.
Emergency rooms are turning away ambulances because there is no room for new patients.
In Las Vegas, 4 area hospitals have been overrun with flu patients, one hospital declaring an internal disaster. And while the vaccine is weak, health officials say it's better than nothing and vital for protecting those who can't be vaccinated.
I strongly encourage parents to receive the influenza vaccine, especially if they have children who are too young, because they need to have any protection they can.
Within 48 hours of the first sign of the flu, the CDC says doctors should prescribe an antiviral like Tamiflu, even over the phone, not even having to see the doctor. And this year, good news, manufacturers say there is plenty of antivirals like Tamiflu to go around, Brian.
Very vital information tonight.